Association organized last night's forum and panel discussion to discuss the recent Supreme Court ruling on the Patient Affordability Care Act, or Obamacare, and its impact on Guam. The governor's chief policy advisor, Arthur Clark, spoke on Governor Eddie Calvo's behalf, saying he supports provisions such as extended coverage to dependents up to the age of 26 and coverage on pre-existing conditions. But
the controversies start with the individual mandate, the health insurance exchange, the tax credits, and Medicaid. The jury is out on whether some of these things apply to Guam. If they did, we need to be prepared for massive cuts in government or tax increases that our struggling people already can't afford. If they don't, we need to ask our federal government why they created a national medical reform system that leaves the territories behind.
Clark saying there's a clear injustice done to territories, citing, for example, currently, Guam is matching 45% of what the federal government gives us in Medicaid funding, unlike in states with similar poverty levels as Guam, like West Virginia, Texas, and Mississippi, which only match 20% of the federal contribution.
What makes us different? With the passage of Obamacare, the federal government will pay 100% of Medicaid costs for every single state that opts in for 3 years. And the qualifications for Medicaid rises from those Americans at 100% of the national poverty level to 133%. That means millions more will have access to Medicaid. That all sounds really good, except that Guam and the territories won't get that 100% gift. As a matter of fact, our matching requirement will remain at 45% until the year 2019. No one knows what will happen after that. As for the states that get 100% matching for 3 years, they will end up only matching only 10% after that. There's so many unanswered questions.
Questions that even Congresswoman Madeline Berdalio's office is seeking answers to. Guam District Office Director Joaquin Perez.
One of our concerns is that because of the poverty level, the increase in the poverty level, the federal poverty level, Medicaid is going to become the largest insurance policy on this island. And you're going to have a good portion of the population migrate over to Medicaid. Now, when that happens and you still have that 45% match requirement, the government cannot afford it. We have a situation now where we get $12 million in Medicaid and we can't come up with a match. And so a lot of that money, a lot of the Medicaid appropriations for Guam is actually returned to the federal coffers. And this same thing is going to happen. We're concerned that the same thing might happen or will happen when this thing comes into effect.
One of the other big concerns raised last night related to medical loss ratios. As part of Obamacare, health insurance companies are required to pay rebates to subscribers if they don't meet MLRs and spend at least 85% on medical costs. Based on filings with the Department of Revenue and Taxation, SelectCare will pay $11.9 million in rebates, while Staywell will have to pay $3.1 million by August 1st. TakeCare's 30,000 subscribers, on the other hand, won't be getting a single penny in rebates. Instead, stockholders of the company will be splitting $15.2 million. According to 2011 audited financial statements, the money was paid to stockholders of the company despite unpaid claims for the year increasing to $11 million and total liabilities increasing to $19.7 million. GMA President Dr. Thomas Shea and TakeCare's Jeff Larson.
But the question is, how can a company allow themselves to take in $15 million of profit yet have that much of unpaid claims? Why not just pay that claim and cut that profit down to $4 million rather than having $11 million unpaid?
Well, again, I'm not going to comment on the details of the $15 million, but the end result is this. We all have claims that we adjudicate. Some of those claims require research, follow-up, so on and so forth. So we, again, comply with prompt payment laws, as do other insurers on this panel and stateside. And when those claims are due to be paid, and provided they're clean claims for payment, they will get paid.
Okay.
As we reported, the legislature, Congresswoman Madeline Berdalio's office, and Reverend Tax are looking into whether TakeCare was able to avoid paying the rebates by being placed under a limited liability company, Vavis.
Whether or not this is a loophole or is not a loophole, more power to TakeCare. I mean, if it's legal, more power to you. But I think the question here is, why are the premiums paid to TakeCare going to this medical travel company and not to providing care? Again, Jeff, I'm going to leave it up to you. You can run with it.
Well, again, the purpose of the forum, I'm not sure, was to debate whether TakeCare's business model is the appropriate model. So I'm not going to comment about Vavis in particular, but I do want to say that, Vavis was created well before MLRs or Obamacare was ever in place. Actually, 2009 is when Vavis was created.
According to Vavis's website, it lists TakeCare CEO and President Joseph Husline as its founder and visionary, adding that in 2009, Husline proudly announced the premiere of Vavis Global Access, a medical travel company that is built on TakeCare Insurance's successful model for overseas medical care and coordination. But we should note, according to documents filed with DRT, that it wasn't until December last year that TakeCare was officially moved under Vavis.
Now, the Vavis employs FHP, physicians, nurses, administrators, is under Vavis or is under TakeCare?
Well, again, I don't want to get into too much detail because I don't think that's the point of the forum. But the point of who's employed by Vavis or who's employed by TakeCare, the Vavis employees are medical professionals in some cases, and they are also responsible for care coordination. There's talk of a loophole. The loophole is the fact that when you look at how the MLR calculation is made, it allows for direct patient care to be included in the numerator. And so, because Kaiser and Geisinger and others have their own clinics and hospitals, those are all admittable assets or admittable expenses under the medical loss ratio.
What wasn't asked last night was, had TakeCare not been moved under Vavis at the end of last year, would it have been required to pay rebates? It's an issue that's currently under investigation.